somebody who has low oxygen saturations from a clinical standpoint and from a diagnostic standpoint has raised inflammatory markers and the CT shows involvement, these are exactly the kind of cases which we want them to move into hospital so that care can be given. On the other side, you will have cases where they're only RT-PCR positive, asymptomatic, and when you do the markers, they're all negative, and these are the kind of cases which can be safely managed at home. Of course, there are cases which fall in between where you have markers which are raised and mild symptoms. So these are exactly the kind of cases where clinicians determine whether they can be kept in a COVID care center or whether they can be managed at home. Number one, the diagnostic is when somebody is RT-PCR positive or somebody is rapid antigen positive. So that's the diagnostic angle through which we look at COVID. The second one is the clinical angle. So all of you know that the symptoms are fever, cough, drop in saturations and things like that. But of late, we've also been seeing non-respiratory symptoms like abdominal cramps, vomiting and loose stools. So we have to look at the clinical component. The other two, which are very important, are the biochemical angle and the radiological angle. Now, the biochemical angle is through blood tests, and there are 3 or 4 specific markers that we look at. Number one, LDH, D-dimer, ferritin, and IL-6. So these are some of the blood reports that we look at when we determine how severe the case of COVID is. And finally, the radiological angle. So in a lot of cases, we tend to do CT scans of the lungs to see the lung involvement in COVID. Of late, we've had vaccines, and then from May 1st, we have the vaccines opened up for people who are 18 and above. So we recommend that all of them above the age of 18 go ahead and get their vaccinations done. But what we've also realized is vaccinations are not the only modality of preventing COVID, but the COVID appropriate behavior needs to continue even after vaccination. So whether it's the masking, the distancing, or even the hand sanitization, these have to go hand in hand with vaccination, and this will help us prevent further waves of the pandemic. So stay home, stay safe, and ensure that you talk to your clinicians about COVID and ensure that only those people who actually need hospitalization come into hospital.